Hello and good evening to all our dear viewers. This is Samvit Goyal, your host for this show. Today, as we celebrate the World Lung Day this week, we at Vaccimune Division of GC Chemi Pharmi Limited have launched a dedicated awareness initiative, NAP, on Nation Against Pneumococcal Infection, with which we are committed to making India pneumococcal infection free. This is because our country contributes to almost about a quarter of the global pneumococcal infection burden, and the problem only continues to aggravate because of rise in pollution within cities, increase in the number of both active as well as passive smokers, unhealthy eating habits, and sedentary lifestyle. Today, we have on our show Dr. Moumita Chatterjee, and she will inform us on how to keep our lungs healthy and what are the benefits of pneumococcal vaccination. Dr. Moumita Chatterjee is a senior consultant in the Department of Respiratory Medicine at Medica Superspecialty Hospital, Kolkata. She completed her MBBS and MD in respiratory medicine from NRS Medical College, Kolkata, and further pursued a DNB in the same field. Hello, ma'am. Good evening.
Good evening.
On behalf of the entire Vaccimune team, I extend you a warm welcome on our show.
Thank you.
Thank you so much, ma'am, for joining us today and for supporting us in our mission on creating more and more awareness on pneumococcal infection. Ma'am, since we celebrate the World Lung Day this week, please share your insights on the World Lung Day with us.
This year, World Lung Day theme is clean air and healthy lungs for all. It's very important because all over the world, particularly in the cities, air pollution is increasing day by day and it is causing more and more chest infection and chronic lung diseases like COPD, asthma. The incidence and prevalence are increasing. So it's alarming to both the patients and for the physicians. So it is very important to highlight certain points. And you have arranged a meeting like this, and definitely I will thank you for this.
Our mission on creating more and more awareness. So
Yes,
let us now take up a list of questions one by one for discussion. And let us first start with the basics. Vaccine and why is it important for adults?
Actually, most commonly, the pneumonia occurs due to one bacteria in the children and in adults, particularly among the aged population. The bacteria is Streptococcus pneumonia. It's a very notorious infection and it leads to inflammation and damage to the lungs. It leads to reduced oxygenation. So, it is the most common complicating cause of viral respiratory infections. So, there are many antibiotics to treat this pneumonia, but you know that particularly among the aged population, day by day, the antibiotic resistance is increasing. So definitely will require vaccination to give them protection against this pneumococcus bacteria.
So now, ma'am, it seems that certainly pneumococcal vaccine is indeed important in safeguarding adult health against pneumonia.
Definitely.
Taking
Actually, pneumococcal vaccination prevents the complicated pneumococcal infection because it may lead to pneumonia, it may lead to septicemia, brain abscess, and many other invasive pneumococcal disease. So it can even result in death. So to prevent this mortality and morbidity, particularly among the aged population, pneumococcal vaccination is very important among the adult population.
Right, ma'am. Moumita, ma'am, it is said that the age of youth is full of vitality, but still there are certain adult age groups which are particularly at high risk of infection. Please tell us which age group of adults is particularly infection prone and should definitely take pneumococcal vaccine.
Yes, we usually prescribe pneumococcal vaccine in the adults above 60 years of age, and another group of patients, adult 18 years to 16 years of age, who have underlying certain medical conditions like chronic lung diseases like asthma, COPD, or any other chronic lung disease, heart disease, kidney or liver disease, those with some malignant conditions or some immune suppressed conditions may require long-term steroid treatment. Particularly, this group of adults require pneumococcal vaccination, and certain HIV infection and like that, immune suppressed individuals also require this vaccine.
Ma'am, we would like to hear what are the different types of pneumococcal vaccine available? I mean, what all options does an individual have?
Actually, in India, mainly two types of pneumococcal vaccinations there. And one is pneumococcal polysaccharide vaccine. We call it PPSV23, and it covers 23 serotypes. Actually, the pneumococcus is divided into the serotypes based on certain antigenic structure. So the PPSV23 is there, and another one is pneumococcal conjugate vaccine, that is PCV13, covering 13 of the serotypes. Actually, certain serotypes are common, but certain serotypes are not. So these vaccines are not independent. Actually, they are complementary to each other. So PPSV23 gives a much larger coverage and protection, but PCV generates a stronger immune response. So we need both type of vaccine. It's very important to know.
So, ma'am, it is apparent that both the vaccines offer unique set of benefits in preventing
Yes.
pneumonia.
Yes.
Now, let us explore the practical side of vaccination. Ma'am, how is it determined that when and which vaccine should be taken and how many doses to take?
Yes, for the healthy population, age 60 years or above, we prescribe one shot of PPSV 23. Okay, and sometimes we repeat it after 5 years, but it depends on the age. Mostly after 65, we don't repeat the vaccine. Okay, and in those adults who have any associated medical conditions I have mentioned earlier or have compromised immunity, then one shot of PCV13 is given, followed by PPSV 23 anytime after 8 weeks of PCV13. And it can be given even after 1 year. It is very important to know, in case a person has got PPSV 23, then PCV13 can be given after 1 year. And immunocompromised people should be given PCV13 first, followed by PPSV 23 after 8 weeks. These are the protocols we follow generally.
So, in summary, ma'am, we can say that the vaccination protocols depend on whether the individuals are healthy or immune compromised.
Exactly. Exactly. And both the vaccines are needed that I mentioned earlier. And those vaccines are not complementary. Actually, those vaccines are complementary, not independent of each other.
Right, ma'am. Now, ma'am, in patients like me who usually have some element of doubt or mistrust against vaccines, for instance, say vaccine hesitancy towards regarding the efficiency of vaccine. So, to clear the air, I would like to ask you, do these vaccines actually prevent pneumonia? I mean, how safe they are for use and do they have any side effects?
See, chronic lung diseases, the respiratory tract infections, definitely they require antibiotics, inhalers, and many other treatments. We give vaccines, actually, it should be very clear that vaccines we give actually not to prevent the infection, but definitely to prevent certain complications. Vaccination definitely reduces the frequency and severity of the pneumonia infection, but we should be very clear that it doesn't prevent the infection. So it's very important, particularly among the aged population I mentioned earlier, that this pneumonia tends to get complicated. And to prevent those complications, we prescribe these vaccines.
Thank you, ma'am. So now I am feeling more confident about taking pneumococcal vaccine. So finally, heading toward our last question, since we are celebrating the World Lung Day this week, what tips would you give to our viewers for keeping their for keeping their lungs healthy?
See, I mentioned initially that today air pollution is increasing day by day, and in this condition, we have to live with a better lung. And if we want to keep our lungs healthy, definitely we should follow healthy diet, healthy lifestyle. That definitely includes regular physical activity, healthy and proper diet, plenty of fluids orally. And definitely, I should mention that if a person gets repeated lung infection or they have certain symptoms of chronic lung diseases like asthma or COPD, please don't go to over the counter medications, or please engage don't be engaged in self medication. Please go to chest physicians. You may have certain underlying lung conditions, get treated for that. And definitely vaccination is important. I mentioned that in certain age group and in certain population, high risk population. So please be aware. Awareness is the key, and keep your lungs healthy, and it will be our message.
Thank you very much, ma'am. This is a very precious piece of advice, since given that nowadays multiple Indian cities have become globally major contributors of pollution. So
Yes.
thank you very much, ma'am, for this precious insight. Now, with this brilliant insight from Dr. Moumita Chatterjee, our session comes to an end. Thank you very much, ma'am, for being with us on the show and for giving us such important, precious insight. Thank you very much, ma'am.
Okay, thank you.
Dear viewers, we hope that you enjoyed our series on patient education and awareness on pneumococcal infection, its prevention, and the benefits of immunization. For more such updates, you could follow us on our Facebook page, and you could also visit us at www.nationagainstpneumonia.com.